Have you ever been annoyed by certain things while visiting a hospital? It's a common experience, isn't it? The long waits, the cold environment, the lack of privacy, and let's not forget that notoriously uncomfortable hospital bed. It's not just the patients who bear the brunt but their families too. These bugbears can turn a stressful situation into a downright frustrating one. So what exactly are these annoyances? Let's delve into the 13 things that totally annoy patients and their families. First on the list, the long wait times. Picture this, you're in a hospital, a place that's already quite unfamiliar and unsettling, and then you're expected to wait. Wait for appointments, wait for results, wait for procedures. It's almost as if the clock slows down, each tick echoing with a promise of yet more waiting. This isn't just a mere inconvenience, it's a source of stress, a trigger for anxiety. You're left with your thoughts that often spiral into worst-case scenarios. This is especially true when waiting for test results. The longer the wait, the more the mind tends to wander into the realm of what-ifs. And then there's the wait for procedures. The anticipation, the build-up, it can be nerve-wracking. It's almost as if you're on a roller coaster except you're stuck on the climb, waiting for the drop that never seems to come. Long wait times can indeed make a hospital visit quite dreadful. Next up, lack of privacy. It's a feeling that's all too common in hospitals. Picture this, you're in a shared room with only a thin curtain separating you from other patients. You're trying to rest, recover, or even just have a moment of peace, but the constant chatter and hustle and bustle of the hospital environment make it near impossible. In these shared spaces, every cough, every conversation, every medical update is within earshot. It's as if your personal bubble, that invisible boundary we all rely on, has been popped. In the process, your comfort, your sense of security, and yes, your privacy, are compromised. This lack of privacy isn't just about comfort though, it's about dignity, it's about respect, and it's about the ability to heal in a space that feels safe and secure. And yet in many hospitals, it's a luxury that seems to be missing. Privacy is a luxury that seems to be missing in many hospitals. Third on our list, uncomfortable beds. Imagine trying to rest on a lumpy mattress or wrestling with hospital sheets that just won't stay put. These discomforts can greatly impact a patient's ability to rest and recover. An uncomfortable bed can exacerbate pain, disrupt sleep, and even contribute to longer hospital stays. It's not just about comfort, it's about healing. The importance of a good night's sleep cannot be overstated. Getting a good night's sleep in a hospital can be a real challenge. Fourth on our list, hospital food. Often considered a punchline rather than a meal, hospital food has a notorious reputation. Common complaints range from being tasteless, bland, or downright unappetizing. Then there's the issue of limited options. Many patients find themselves stuck with the same meals day in, day out, which can be especially frustrating for long-term patients. And don't get us started on the texture. Unfortunately, it seems hospital food often leaves a lot to be desired. Fifth on our list, lack of communication. It's a common complaint and one of the most frustrating aspects of hospital stays. Imagine being in an unfamiliar environment, feeling unwell, and yet not knowing what's going on. Patients often feel left in the dark about their own treatment, diagnosis, or care plan. It's like being a passenger on a journey with no idea of the destination or the route. Doctors and nurses, while highly skilled and well-intentioned, can sometimes forget to keep patients informed. They may use medical jargon, which can confuse rather than clarify. This can lead to feelings of anxiety and helplessness, adding unnecessary stress to an already challenging situation. The solution is simple, clear and effective communication. It's about more than just delivering information. It's about ensuring understanding, providing reassurance, and fostering a sense of partnership in care. After all, a well-informed patient is an empowered patient. Clear and effective communication is crucial in a hospital setting. Sixth on our list, noise levels and lights. Imagine trying to get some rest amidst the constant beep of monitors, the hustle and bustle of medical staff, and the harsh glare of overhead lights. It's not just a minor inconvenience. This constant sensory overload can disrupt much-needed sleep and heighten feelings of discomfort. After all, a calm and quiet environment is conducive to healing. It's hard to relax in a hospital with all the noise and lights. Seventh on our list, the cold hospital environment. We're not just talking about the temperature, although that can certainly make one shiver. It's more about the sterile, clinical ambiance that can make patients feel uneasy. It's understandable. Hospitals need to maintain a high level of cleanliness to prevent infections. But the stark white walls, the gleaming linoleum floors, the harsh fluorescent lighting, it can all feel so impersonal and intimidating. Imagine being in a place where everything screams medical and sanitized, where the air has a certain antiseptic tang. It's a constant, unwelcome reminder that you're in a place of sickness, not a place of healing. It's a world away from the cozy comforts of home, and it can leave patients feeling more like specimens than people. Bringing a touch of warmth, a hint of homeliness into this cold environment can make a world of difference. A little warmth and comfort can go a long way in a hospital setting. 8th on our list, the cost of care. A hospital stay is rarely a planned expense and can be a significant financial burden. From the moment you step into the emergency room, the costs start piling up. There are charges for everything from diagnostics to medication, not to mention the hospital room itself. Patients and their families often find themselves in a whirlwind of bills and insurance paperwork, adding stress to an already difficult situation. This financial strain can even affect the patient's recovery, as worrying about money becomes yet another hurdle to overcome. Even with insurance, out-of-pocket costs can be substantial. Coverage varies, and patients might find themselves facing hefty bills for services they presumed were covered. It's a complex and frustrating system, leaving many feeling helpless in the face of mounting costs. And let's not forget about the cost of aftercare, medications, and physical therapy. It's a long and expensive road to recovery. Healthcare costs can indeed be a pain point for many. 9th on our list, limited visiting hours. Let's talk about the clock-watching frustration that comes with strict visiting hours. Imagine the disappointment when you're all geared up for a visit, and you find out you've missed the window. And for patients, these restrictions can be a real morale crusher. Being confined to a bed with limited contact can make the world feel a lot smaller. It's a paradox, really. Hospitals, places for healing, yet the stringent visiting hours can often make a hospital stay feel lonely. 10th on our list, inadequate parking facilities. Ever circled a hospital parking lot like a hawk, hoping for a spot to open up? That's an all too common experience. It's hard enough dealing with a hospital visit without the added stress of finding a place to park your car. Sometimes the parking spaces are too few, too far, or simply too expensive. It's a small detail, but it can set the tone for the entire visit. Parking should be the least of your worries when visiting a hospital. 11th on our list, inconsistent care. Often patients and their families experience a roller coaster ride when it comes to the quality of care provided. One day, it's top-notch. The next, it's as if you're dealing with a completely different team. This inconsistency can lead to feelings of uncertainty and dissatisfaction, not to mention the potential risks to a patient's health. Picture it like this. Imagine going to your favorite restaurant and ordering your go-to dish. One day it's prepared perfectly, but the next time it's undercooked and unappetizing. That's what inconsistent care feels like. But in a healthcare setting, the stakes are far higher than a ruined dinner. Inconsistent care can stem from many factors, including staff turnover, varying skill levels, and even simple human error. Regardless, patients deserve consistency. They deserve to know that they will receive the same high standard of care, day in and day out. Consistent, high-quality care should be a given in all hospitals. Finally, lack of personal touch. In the chaotic hustle and bustle of hospitals, patients often feel like they're just another number, another case to be swiftly dealt with, another name on a chart. This impersonal approach can leave patients feeling devalued and disheartened. This isn't just about the emotional well-being of the patients, it's about their overall treatment too. Personalized care goes beyond just knowing a patient's medical history. It's about understanding their fears, their hopes, their lifestyle. It's about connecting with them on a human level. A friendly word, a reassuring smile, a moment of genuine empathy can lighten the heavy burden of illness. Moreover, when healthcare professionals invest time in building a relationship with their patients, it can boost the patient's trust in their care, leading to better cooperation and, ultimately, better health outcomes. Healthcare isn't just about medicine and machines, it's about humans caring for humans. A personal touch can make all the difference in a patient's hospital experience. And there you have it, 13 things that totally annoy patients and their families. From the dreaded hospital visit, the long wait, lack of privacy and uncomfortable beds, to hospital food, lack of communication, noise levels, the cold hospital environment, the cost of care, limited visiting hours, inadequate parking facilities, inconsistent care, and the lack of a personal touch. Remember, understanding these annoyances can help make hospital visits less stressful and more comfortable for everyone.